write, and so on and so forth. So it's potentially transformational for people with disabilities and impairments, but it's quite a challenge in the system. So if we go on, Peter. So how does the digital flag work? At the moment, it's in progress. So if we remember that, so this is how it should work. So frontline staff, and when I talk about frontline staff at the moment, is predominantly NHS frontline staff. Will frontline staff, who come into contact with patients need to first of all identify that this patient in front of me needs some reasonable adjustments, which they then record on the system. And then that's followed by what reasonable adjustments the person needs. And all of this goes coded onto a health record. And when it's in place in social care or adult social care, it will go, it will be there too. What else? So, and the flag can actually be added by any health and care staff who are working with a patient. Yeah. And it can be reviewed and updated as needed, and it will be updated and reviewed and seen in real time. And so alongside frontline staff, so the IT suppliers who provide the record. So I know in social care, Log My Care is a big program or IT supplier for records, but I know there's several others. In the health service, there's quite a number. So all of these IT suppliers at the moment are working with the National Reasonable Adjustment Digital Flag team to work on operability. And what I mean by that is essentially your IT system in your place, if you've got one, lots of people won't. In social care, we don't necessarily all have them, are working with the national team to connect the information that we put in a reasonable adjustment to the spine, the NHS spine. When that information goes live, essentially what live means is they talk to each other. Wherever that patient turns up in the health and care system, we will see that they've got a flag on the system and see what reasonable adjustments that they require. And that's being worked on at the moment. Full conformance, so all organisations should have conformed to this by September this year. That is not going to happen. I can see that. I lead for London on this. I can see that that is not going to happen. But there will be huge progress, especially in the NHS by September. And the reason I put the NHS up down there is because at some point, and work is ongoing at the moment, if you've got a reasonable adjustment flag and you've got the reasonable adjustments that are noted in place, it will go onto your NHS app. So then you can show people this is what it is. Next slide, please, Peter. Please put any comments, thoughts in the chat and we'll come to them at the end. So this is, so imagine yourself as a health professional, or it will be social care, and some of you may do this in the future, but many of you won't. You won't necessarily be doing it. I've got a patient, they come to me, I recognize they need reasonable adjustments, and I think about what reasonable adjustments. Now, this is part of a letter that some organizations are sending out to patients, asking them what sort of reasonable adjustments do you require. Now, this is just a very small sample, but it gives you an idea. So I know for the Royal Free Hospital are sending out a letter like this as soon as a patient gets an appointment. They fill that in, the letter comes back, and they record this on their system. And you can see some of the reasonable adjustments there. I won't go through them. And the link underneath is to a Futures platform. Some of you may know about Futures platforms. They're specialist information sharing platforms. Established by the NHS, but you can certainly access them. And everything you need to know about the reasonable adjustments digital flag is on there. If you go to the next one, Peter. All of this information that I'm sharing with you today, Peter, if you don't send this out, I will send you another one, but all of it I will just send out. To give you some idea, so this is some posters that have developed for patients themselves, and on the right-hand side is a slightly different audience, and all of those I will send out. So lots of work have been developed around this. Next one, please, Peter. And just a couple of last points then in terms of, I think, that your role. So I'm just going to say a couple of things. So statutory social care, again, legally, they have to apply the reasonable adjustment digital flag and work with it. What I would say at the moment, they are significantly behind the NHS at the moment, but it will come. So in there, if somebody goes on along to an adult social care and sees a social worker for an appointment, at some point in the hopefully not too distant future, there will be a flag built into their system that says this person in front of me is entitled to reasonable adjustment and what adjustments they are. It's a bit behind. In terms of the voluntary sector, again, it will come out to you, but it is significantly behind. And that's because, of course, the IT systems you use are slightly different and how they connect is a bit different. So I suppose what is my ask, or what I think maybe the takeaways today, and please come back and contact me in the future if you want, is like, be armed with the knowledge. The reasonable adjustment flag is out there. It's in law. We have to record someone's reasonable adjustments and we have to abide by them. What is reasonable is not defined in law, but that's a presentation for another time. But those lists of adjustments that I've given you, I will send out alongside the presentation back. But I suppose, what is the ask? It is a bit about being armed with this knowledge really at the moment, and consider what adjustments, reasonable adjustments are needed for the people that you support and they would benefit from. And maybe at the next health appointment, ask about them. Is there a flag on the system? Can you put a flag on the system, please? And these are the adjustments. And like I said, Peter, I will send out this presentation, but also I will send out the letter that shows you all the adjustments, really. People are unique. Not everyone will fit into a box of all the adjustments that are coded. So there will be a code for a free text narrative. So if you don't fit into this box, you can write down what the adjustment is. So that's my reasonable adjustment digital flag. Go ahead, Peter, the next one. Now I'm going to talk about the Universal Care Plan. Now I'm pretty sure there will be people on the call that will know about the plan, or at least heard of it, I'm sure, because this is not new. This has been out for a little while, and there's been a really big push to try and engage social care staff who are really important and equal partners in this. So what is the plan? So it's since January 25, the UCP has become a digital personalised care and support plan. Enables all Londoners to share what matters to me. Prior to January last year, it was an end of life care plan called Coordinate My Care. Some of you may well have come across that. So it can be accessed by health and social care staff, across London, and viewed by doctors, nurses, ambulance, NHS 111, social care staff in the local authority and the independent sector. So everyone across the health and care landscape can access the Universal Care Plan. Now, who can create it? So it can be created again by health and care staff across the sector. It's meant to be a collaborative document. So you might put some stuff in it that you know about the person you support, that you know really well. It helps them fill in what matters to them, and a few other bits of information. And then doctors would fit in maybe some clinical bits of it, because it's designed for collaboration, really. And it's updated in real time. So once we filled in that form and it's submitted, everyone across the system will see the information that's put in it. So it's all age. It's not restricted by age. It's a form that you only complete what's needed, and information is shared, as I said, in real time. So for those of you who are maybe in the field of learning disabilities, we had a hospital passport. That still is there, but what we certainly hope is this will take the place of a hospital passport, because this is essentially a digital hospital passport, but much broader. And also, so for anyone on the call now who is a Londoner, you will see on your NHS app, if you want to look after this meeting, you will see that under care plans, you will see UCP. Now, of course, it will only open if you've got a UCP, but it actually sits on the NHS app. Next one, Peter. Great. So who's it for? So I'm just going to give you a few seconds to look at that slide. Now, all the cells that are dark blue, all of those groups, there'll been professionals and other people involved in the development of this expanded care plan, which is why I've highlighted those there, or why they've been highlighted. But essentially, you look at the top box, anyone can have a UCP. If you think it's going to be helpful for you, for health and care staff to know about you, actually anyone can have one. If we carry on. So when we think about the benefits of the UCP, we break it down into what are the benefits for the person themselves, what to staff, and when I say staff, I mean staff across the health and care sector, and then what it is to organizations. Now, I've highlighted a couple of things, but you'll have the slides so you can read through them. So if we think about the individual, so you've got the entire support network around you will all be on the same page. There will be one single plan. There will be other information in the system, but this will be a shared single plan. And the UCP team want to think about this as a single version of your care truth. Now, we probably all know that across the health and care sector, there's lots of different plans and potentially conflicting information, and updating information in real time is really hard. So this is really a massive step forward in that. For staff, it's an easily accessible care plan, accessed different ways, but also the potential to edit and update again in real time. For organizations, I think there's a lot about reducing crisis through early access and support because we've got the right information. What we know from serious incidents and when things go wrong, it's often around poor communication and poor information. The UCP really helps with that, because we've got it accessible and timely. Go ahead. Next one, Peter, thank you. So every month, the UCP team, they sit in South East London, produce a report. Now, there's a lot of information on this slide, so don't worry about all this information. There's quite a lot. I will share it, but it is really helpful. And I'm just going to highlight a couple of bits of data from here. So in January this year, over 48,000 care plans were viewed within the health and social care sector. So that's a lot of care plans. And nearly 400 new care plans were created. If you look, I think at the right of your slide, I think it's the right, with a little donut, you'll see that the independent providers and care homes and home care sector make up about 10% of those logins, that viewed the plans. And what we know is that's growing significantly. So we know that in 2025, care homes accessed the UCP via the web portal, I'll tell you about that in a minute, grew by 75%. So it's going up. I know that in Bromley, if there's anyone on the call from Bromley, that Bromley have put a lot of time and energy into supporting care homes to implement the UCP. And I think every care home in Bromley is signed up. If you want to move on, Peter. And just to show, because I am breaking down the information a little bit because of my background and field, what we know now that the Londoners with the UCP who've got a learning disability or autistic is going up. And part of my role is about supporting adoption of the UCP amongst people with a learning disability and autistic people. So we know it's going in the right direction. So if there's any providers here who are learning disability providers, please contact me if you want more information. And for those of you providers who are not in learning disabilities, there's still places to go because there's a champions group running. Go ahead, Peter. Also, one thing about the carer contingency plan is if you work with people in their own home and they maybe have an elderly carer, a frail carer at home, and you go into 2-3 times a week or day or whatever, the carer in their own right can have a carer contingency plan. So if anything happens to that carer, all the services around them will know that they're a carer, who they care for, and what are the plans in case of any emergency that happens. If LAS pick up a carer on the street, as soon as they access their record, they will know that they're a carer and they will know what to do. Next one, please, Dieter. And there's lots of information on this slide, but gives you a bit of an idea about the content of the UCP. So I'm just going to give you a couple of seconds to read that. What I would do, I'd read down the amber and the blue, but I will send this out. Now, one of the, I think, the highlights for me in terms of this form is that section on what matters to them or what matters to me. So I think this is the first, well, I know it's the first ever had a care plan that is shared right across the system that really wants to put the person at the heart of that plan. If you don't move ahead, please, Peter. So at the moment, right at this moment, if you want a UCP, you have to get someone to help you do it. Yeah, so a nurse, a doctor, various community staff, they will need to sit with you to help and complete a universal care plan. But next month, at the end of next month, there's going to be a slow rollout where people themselves can create their own UCP. They'll only be able to complete some areas because the UCP is role-based access. So depending on your role, you'll be able to complete all of it or part of it. As a patient, you'll only be able to complete part of it. And some of the medical and clinical stuff other clinicians would complete. But that's a really, really big leap forward, I think, in terms of the UCP. So someone in a very short term, in the not too distant future, will be able to go onto their own NHS app and start a UCP. Next one. So if you're sitting there thinking, well, how do I access a UCP? Two main routes. So you go onto the web portal. The UCP has got a web portal. And it got all the information that you need about how you join up. And there is a bit of a process. Don't forget, we are accessing personal records, so we've got to make sure it's compliant with data protection and so on and so forth. And the second route is through the London Care Record. Now, there will be some people on the call that have access to the London Care Record, I think. So for those of you who don't know what the London Care Record is, and they use different names, HEI, Health Information Exchange, or HIE should be, sorry. And there are a couple of other names. So the London Care Record is a shared care record. So again, if you're a Londoner and you go to your GP will see your notes. But part of your notes, there will be a link to the London Care Record. And in that London Care Record, because it's a shared care record, it pulls in information from various sources. So if I was in a hospital settings, for instance, I would see bits of information pulled in for your GP, bits pulled in from social care, maybe acute care, mental health, and so on and so forth. Anyone else involved in your care. It's just part of the record, but it's a shared care record. And the UCP sits on this record. So if you've already got access to the London Care Record, you'll already have access to the UCP. Most of you, though, won't, though, and it will be web portal access. If you go forward one. So here is, at the bottom here is a link to the Universal Care Plan, UCP resources for home care staff. So on their website, they've created loads of very specific resources for basically for social care. And there will be a how-to guide on there. And that's just showing you some of the resources. If you go on, Peter. So actually, I've finished a little bit quicker than I thought. So now let's go back to Addy. So now let's think. So Addy's got his reasonable adjustment digital flag in place. Yeah. So he doesn't need to feel anxious because he's got the flag tells people that he needs a double appointment. Yeah. So he knows he needs more time to communicate, that his carer will be allowed to come in and participate in the consultation. He needs an appointment later in the day to make sure he can have his insulin and his early morning carer support. And also that he's got his UCP in place now. So there's a lot more information all in one place that you know, and the doctor knows, and anyone else in the hospital has got right in front of him. That's important in terms of that individual consultation. Yeah. And that's because they'll have both of those in place. And if we go on, I think that's probably it. So any thoughts or any questions? And there's no such thing as a stupid question, daft question. So, and any thoughts that you have, I'm quite happy to try and answer.
Can I stop the screen share now, Tricia, or do you need any?
Yeah, you can. My details are at the back, but I will send these out with the letter around what the reasonable adjustments are, so it'll be more obvious to you.
Any questions? Fire away.
I'll start. Files are here. Just want to know how much do you think local authorities are ready for this?
So if I go for the reasonable adjustment flag, not very much, not at all. I would say very little. So I run a London-wide implementation group for the reasonable adjustment flag, and we've been trying to get the local authorities involved. It's been slow. Yeah, but they will have to come on board. They absolutely will have to, because it's law, essentially. They have to do it. They will. And that's no disrespect to local authorities. You know, everyone in the health and care sector have huge priorities. Yeah, there's loads of stuff going on, but they will have to come on board. So they're not. What I'd say is awareness is going up, but the actual implementation is very slow.
So the 30th of September deadlines applies to everybody, yeah?
It applies to everybody.
In England.
It does. But in reality, I do not think that will happen, if I'm honest with you. Yeah. If we think of the Equality Act as being law, and then if we think about how many people don't get reasonable adjustments, forget about recording them, but don't get reasonable adjustments. Yeah. Even sometimes we don't get the law when it's implemented, you know, nothing really happens. What I would say is, though, this will definitely be implemented.
It will be very helpful. I could think of so many of our service users, if it had that, it will be so good for us. But what I'm thinking is, so if we don't get it via local authority, generally we get care packages via local authority. If they don't have it, that means they can't pass it on to us. That means we have to either bypass the local authority and go direct to the NHS, assuming that there is one, and then get one, access to one, or create one ourselves.
In terms of, so think of the reasonable adjustment flag and the UCP as separately, yeah? So in terms of the UCP and the local authority, some are a little bit involved, they're not massively involved. Learning disability teams, because I'm involved with them particularly, are much more involved with the Universal Care Plan, and I start definitely supporting the creation. But whilst those of you on the call at the moment can't create a reasonable adjustment flag, you can create a UCP. Yeah, so there's a process to go through, but you can definitely. And I know from terms of the UCP and myself is actually we really need the health and social care sector to have complete clarity around this. Yeah, because it is really important.
So, sorry, so would it be by after 30th of September one of the CQC requirements to have one?
That's so the UCP. Put that aside at the moment, because that doesn't have a conformance date. That's not by September. The reasonable adjustment digital flag is, yes. Would CQC be asking about it? Probably, if I'm really honest with you. Do I think there will be penalties for not having it placed? No, I think that is highly unlikely, because actually the most important thing you can show is you just generally make reasonable adjustments. Yeah, and you should be doing that already. Because in terms of the reasonable adjustment digital flag, this is a big IT program as well. This is about connecting your IT system, if it can be, with the NHS spine.
Ali, did you have a question?
I did actually, and it dovetails beautifully into that last statement, Tricia. You said about ensuring that the systems talk to each other. Now, a number of our providers, they have some wonderful IT systems, and I know it's something that Lcas and Skills for Care are really encouraging people to perceive that digital connection. But it's only really going to be successful if we can tie everything up together. In this process, rather than staff members necessarily having to repeat information on different systems, is there a process that allows that information to be collected and delivered either through the systems we've got already or at least some sort of tie-up?
Yeah, well, that is the intention of the reasonable adjustment digital flag. Yeah, so again, let's make them separate. So the reasonable adjustment digital flag, say for instance, I am in a clinic, I add this person meets the criteria for reasonable adjustments, and these are the reasonable adjustments, and I put that on the local system. So in the hospital, I'm in a clinic, I put it in the system. So my system locally in this hospital already communicates with an NHS spine. And as soon as it communicates with the NHS spine, things will go up and down the system. So if you've got a system at your home, for instance, I've put it in the clinic, now you're connected with the spine, you will also see what I have written. So it's one flag. Yeah, it will go around the system. But every individual IT supplier, whatever IT system you've got or supplier you've got, needs to be connected with the NHS spine. Now, I have in my signature, and it will go out, there's a way for IT suppliers to register with the national team. Yeah. But what I don't know, Ali, and this is really I don't know, within social care, you might have some very small IT suppliers. Obviously, in the NHS, we have some.
Yes, loads of them. Yeah, I mean, this is the thing.
Yeah,
it's tying those processes up.
Yes.
Yeah.
But there is
my door has. I've just had a knock at the door. I'm really sorry, but please do continue that information because they will appreciate that. Okay, 1 second.
It seems to be one of those meetings today where everything just seems to be going on, knocking on doors, systems in and out. So I think we're getting there. So thanks for that. I'm not sure if there's any other questions to come on that, or Tricia, if you've got anything else to say. I think we may be moving on to our next.
Make a quick point, Dudley.
Go on.
Just a quick point, and this will come up again and again. Dudley and another colleague will go into some more details about things like DSPT.
Yes.
Because of the work that Lcas is doing, we've come across a lot of NHS mailbox addresses. People have got, they've done their NHS mail, which is great, but people aren't using their NHS mailboxes and they're not checking them. So if you've got an NHS mailbox, please actually check it. And again, we know that some NHS units, hospitals, etc., are not using the NHS mail in the way that they should be. But please try and insist, because if there's a data breach, it'll be a mess. But just the basic point, folks, is if you've got NHS mail, please check the mailboxes. Sorry, Dudley, over to you.
No, that's fine, Peter. I think I was going to move on. He sort of like beat me to it. And if there's any other questions, you can share that in the chat box. Thanks, Tricia, for the information you've shared. I think there is an element now of really sharing information, but actually people's details and records and the right information is key here. And I think that's why we want people to have things more accurately, more up to date, more on time. Things which we've known before are not accurate can cause other issues. And we could talk about the elements around well-led and governance and audits, CQC. I'm not going to go into that one, but usually, and I'm sure it's been said a lot of times, NHS sometimes look down on social care of not being organized or not being professional, and this is a way of actually showcasing that we can be professional and keep our things up to date. So
you get a lot of brownie points in CQC if you know when you're signed up, I can tell you. But it really does benefit UCP, and the flag does benefit everyone.
Thank you very much.
You're welcome. Okay. Take care. Bye.
Right. So we're going to move. Thank you so much. We're going to move on to our next speaker. It's very quick. After that, we'll go with Skills for Care. Harry, I'm not sure if Harry is
I've made it. I'm here.
Thank you, Harry. So right now, I'm sure you're aware most providers, if they're not using some form of digital system, software, they are using something in some shape or form. And the bigger picture now that we know about social care, but not just social care, but beyond, is the elements around cybersecurity. Is your information safe? Is your data being shared in the correct way? And one of the things that the care sector has looked at is ways of how we can improve that. And I'm going to let Harry Dawson speak, because he's one of the individuals who has been helping, especially from a Southwest London point of view, making sure that providers are secure. I'm going to let him just go through a few things, and then I'm just going to add in it afterwards. So I'll leave the floor is yours, Harry.
Thanks, Dudley. Yes, I think it's quite a helpful transition, really. So, yeah, I'm Harry Dawson. I'm the Senior Health and Social Care Integration Officer. So, for the last 4 or so years, I've been supporting providers in Southwest London connect to things like the Universal Care Plan, the London Care Record. And obviously, a big part in being able to get the access to that is having DSPT, which obviously a lot of you are going to be familiar with, especially around the care homes. I think in Southwest London, 95% of you are at standards met at the moment, about 50% of the domiciliary care providers as well. So obviously discussions around the UCP, if you are wanting to have the access or remain having the access, it's very important to make sure that your DSPT is up to date. So that's the Data Security and Protection Toolkit. So this is something that the ICB was previously supporting with, and now that's going over to the Lcas team. So I'm sort of here supporting with that transition over at the moment. So the support to go through the toolkit is definitely still there. Sort of here just to say that if anyone wants to sort of have any one-to-one sessions to go through the questions, get a better understanding of what the questions are asking you, then the support's very much there. And that sort of links also well with what Peter was saying around the NHS MAIL. One of the biggest issues we run into is people not accessing their NHS MAIL accounts. You lose the access, then you spend a week trying to get hold of the help desk to get your email sorted out and then get back onto the UCP. So the DSPT is something that's a yearly toolkit. So for quite a lot of you, we've got the end of June deadline coming up that you'll need to republish by. If you are using any of the digital records like UCP, London Care Records, you will need to make sure this is completed this year. Otherwise, you will lose the access to all this helpful information. So just really a good point to sort of step in and say, although you've got all the access to the amazing things, it's very important to make sure that you've got all the sort of background steps completed first as well. Anyone got any questions on DSPT? Anyone needing support in completing at all?
Just let me step in quickly, Harry.
Yeah.
Harry, if you can put your details in the chat, we'll also share some information.
Yeah,
Lcas.
that's quite helpful because we're just going through. Hi, this is Norma from Opera. Just to
hi,
say that
Norma.
we've got an appointment coming up in May. We've been given one for May where they want to come around and see how we protect information data. I want to believe that's what it is, but I think prior to that visit, it should be helpful if someone can just take us through so I'll just know what to expect on the day.
Yeah, definitely. I'll put my email in the chat.
Please.
And
Thank
yeah, this is something that obviously CQC are starting to look at more and take interest in to see if providers are at standards met on the DSPT as well. So it's definitely something really beneficial to have.
Thanks.
Thanks for that. And anyone else wants to, I mean, the bigger picture, I think if anyone understands, is now with CQC there, when they're doing their inspections, they're looking at those organizations that are well led, whether you have any policies in place, audits in place to cover elements like data breaches. And CQC are really may not be telling you openly, but I think it really bears in mind if you haven't got things set out, especially in your policy and your records, and actually complying with the DSPT toolkit is as an evidence, the way of evidencing what you've done. That toolkit gives you a comprehensive overview of your cybersecurity, your software, your systems, audits, and it's all done, and we will help you through it. The likes of Harry and Lcas, who are now the delivery partner in South London, so we cover that, and in North London it's been done by the Care Provider's Voice. So the aim is we help you, so rather than you having to stress, it's a case of booking an appointment. There's certain questions that you can go through, as Harry has mentioned, I think the great thing about South London in itself is that's one of the top regions in the country that have really done well when it came to adhering and sort of complying with the actual DSPT toolkit itself. So it's a case of now of updating what you've got in place. There may be a few changes, and there's a few more questions as well to be added in for you to cover as well. So I think it's a good thing, and I think it's just really just yearly just making sure you update so you're not caught out. And I think other than that, feel free to call us, because I know a lot of people are now getting new different softwares as well. And the thing that also amazes me as well is it doesn't just apply to your PC or your laptop. It's also other devices like your mobiles, and people are using a lot more mobiles, or your workplace are using more mobiles, and this carries lots of data, and people actually forget that. People are jumping on things now. Social media, we're now using AI a lot. There's so many areas in which data breaches may occur. Yeah, go ahead, Harry.
Yeah, Dudley, you're completely right. I think, although obviously I discuss around the projects of UECP and stuff, even if you're just using paper, some homes might be just using their personal phone for work. And, in some examples, that could be a data breach. And that's something that you need to be recording on the toolkit. So that's, yeah, as you say, a very important thing to note.
Yeah, and thanks, Harry. I think the funny thing, if we had this conversation about maybe 4 or 5 years ago, it would get tumbleweed and not much response from many providers. But now we now know that it's almost running through the veins of most organizations. So actually being compliant or making sure you're covered, whichever organizational system you're using, is actually overarching of your business as well. So please make sure that you're compliant by the deadline, which is it, the 1st or middle of June?
Yeah, 30th of June it's going to be. So the end of
June.
June, is the next deadline. So any providers that currently show the 24-25 standards met, that's going to go out of date end of June. June time does get very busy with lots of providers asking for support. If you get it done now, it's going to last you till next June anyway. So if you want the support, get it done now. Saves getting it done when everyone else is asking for the support as well.
Thanks. And we'll send you also, you can log in, we'll give you an email address, and we can start booking appointment times, and we'll try and do our best to get through it as much as possible. And it's possible. I think we can showcase that still South London is still the best place in the country as well. So for those who are from South London, those who are not, apologies. North London aren't too bad as well. But thank you very much. Is there any other questions from anyone who wants to share any information or ask any questions in regards to this? If not, the information is going to be shared. Oh, Harry, go on. Sorry.
So I was just going to say the support is still for those wanting to get access to the London Care Record and Universal Care Plan as well. And we did recently pilot for a few domiciliary care providers to have access to the Universal Care Plan. So if there are any on the call who are wanting to get the web portal access, please do get in touch on the email as well, and we can help you through the steps there.
Yeah, thanks for Harry. And if you're just unsure and not sure what to do, there's no question which is, ridiculous. I mean, you may think, oh, I've just bought this PC. What do I have to do? Or we just got a new service. So any question that you have concerning this area, especially around anything to do with your IT systems and software, please get in touch with us, and we'll try and steer you in the right direction, and we'll do our best to answer. And I think now is the time, obviously, to help and to avoid various things as well. So thank you very much for that. And we'll share the information, and you can also access information via the website as well. Thank you very much for that, Harry. So on that note and a transition, we're going to now introduce a wonderful Ali Porteous from Skills for Care. And Skills for Care, if anyone doesn't know, has always been a great organization for social care on a national basis, sharing lots of information. And Ali's going to help us understand what's the latest sort of things and updates with Skills for Care. And I will now leave it with you, Ali.
Excellent. Thank you. First of all, what I want to say is not necessarily from Skills for Care, but this is from an old woman who's been doing this job far too long. I've been running homes and what have you, and I have been involved in all sorts of bits for the last 40 years. The big change now is plan. Make sure that you understand what's required of you. The information that's been given to you this morning is huge. And I'm about to download a whole load more information, but I will support it with some PowerPoints that I'll pass on. It is vital at the moment. And I talk to you now as registered managers and as important people in your businesses. Make sure everybody knows what's going on. Make sure that as you're going through your end of year finances, you're building in the costs of some of these requirements that are there, and ensure that the staff are able to do the job. If you're not claiming some of these opportunities, then you've not put people in place who really want to engage with this. And this is an opportunity, as Tricia pointed out, CQC is looking to see how you are running your organizations and how those organizations are making a real difference to the people that you serve. And by taking on the information that Lcas is offering through today's meeting and putting a plan in for digitalization, you show that you're running a business that is looking to the future and is using all the key resources that can give the best outcomes for the people we provide care to. So before I start going into the rhetoric of skills for care, I wanted to do this call from the heart as a real ex-manager myself. Plan, record, and plan again. Review and get your teams involved. So with that said, with my little moment of please think carefully about the care work, I'm hoping that I am now going to be able to share a screen. Now, somebody's going to have to let me know if I'm sharing that. Can anybody see that screen?
We can, Ali. You just might have to.
I'm
just
going
jump
to
jump.
I will go straight to slideshow, most definitely. Here we go.
Magic.
Excellent. You now see it the way you should be seeing it. Marvellous. So for those of you that don't know about Skills for Care, we've been around for a very long time and we are going through a process of change, as all organisations are, but we continue to be a really important link for you to be able to see what's available and some of the training resources that are also available. We support you and your workforce to make the best of every opportunity. So I've got 40 odd slides here, but I'm not going to go through them all, and I'm going to flick through a few because I think that they're a little dull and not as interesting as what we can talk about as a group. So first of all, let me just give you some information about some of the things that are coming up at the moment. We are very, very aware that the work that's going on, and it fits nicely into what Tricia was saying, around supporting people with dementia is really key. We've got new people coming into the industry who may not have the skills and knowledges that are available. And I love these resources because they're easy to download and they're really great to give to staff who may not have worked in this field before, or who may not have necessarily focused in on the needs of people with dementia. We need to ensure that that personalisation is there, and these tools help you with some good conversations and resources to provide for your staff as you move forward. Now, all of this is available on our website, but you can always use this PowerPoint to reference bits and pieces. We're not only looking at dementia as being important, but we're also looking at the impact of mental health. So again, exploring that framework and ensuring your staff and your team are fully aware of what's going on and the updates is key to ensuring you're well led. We have a number of different other resources that are coming up, and some of the big things that we're talking about at the moment is that idea of how we ensure all our teams are working in a common way. So please think carefully about how you work with your groups, helping to design and recognise some of the biases they may have and how to behave with the clients in a way that is respectful and ensures it meets the needs that you've set out in your original agreement with them. Now, I don't know about you, but one of my biggest bugbears was medication errors. And it was so important that we ensured that people understood why medication errors are so important to recognise, but how to ensure that they don't happen again. So I would really ask you to take a little look in this, and if you've got somebody who specifically looks at some of the challenges in your organisation and looks at some of the long-term planning, it's an important thing to recognise why medication is so frequently a safeguarding issue that we look into. I got a safeguarding issue once that was involved in the hospital picking up and taking the wrong medications with them. Caused no end of an error, and we ended up putting a really good process in place that ensured that we never got that safeguarding again. So it helps you investigate and to really create a plan for the future. And that all comes round about supervising your staff and ensuring that you're making the most of that key little time you have with your staff to talk to them about how things are going. And many of you are looking at how your nursing needs are changing within your environment. So one of the things that we really want to do is help you with that nursing journey. So please take a look at some of those online resources. Have a little look at some of the clinical work you're doing. If you're supervising nurses, please come back to us and let us help you make that supervision something that's valuable for the whole organisation. Now, we continue to have our networks. We love our networks. And I would say that along with the work that we do with Pete and Dudley, we have regular wonderful systems that go on in the local area, and we're reviewing those to go online and have face-to-face, but we need your information about this. So please think carefully about feeding back anything that you think we can use to improve our meetings with you. And we share these with the care associations as well to ensure that you're getting that information in the most appropriate way for you to help your business develop. So one of the things that has come up about this, and we'll look at this again, is a call for action in regards to some of the funding. If you are not receiving funding for training, then you're missing a trick. I would say to anybody, if you need to think carefully about how your training is funded. We have so many changing needs of our staff at the moment, and we're looking at so many different opportunities that are available for them to build on new knowledge. And that's everything from digital to specialised forensic work within mental health and learning disabilities and dementia and other areas of that nature. So what the government has done is, I hope all of you are very, very much aware of this. They have created a list of courses that they will fund for you. That list is available for you. As you can see, we've got links to the government website in this particular piece. Have a look. If you've got staff who've undertaken this training or who are looking to undertake this training, think carefully about how you're going to cost that funding. And we're running towards the end of time here on this particular year's funding group. So the LDSS supports people to employ staff who are well trained and have the eligible courses refunded to them. You need to be part of the adult care data workforce set. And if you have any issues with setting any of those accounts up, please come directly to me, because we can support you with that. We are the ones that manage the data set. That informs the government of where the needs are, but also you can't claim that money back unless you're through this data set. So please look carefully about how you're planning your business as you move forward, and ensure you're making the most of all the resources that are out there, because they are key to ensuring you've got a good service. Now, Oliver McGowan's been an ongoing issue for all sorts of different areas. There's been a lot of different people in this space at the moment. What we would ask you to look carefully, and the deadline is coming very close for the Oliver McGowan area, but look closely at the training that you're offering and how you can claim that back. Again, this is a good opportunity to ensure your staff are competent and compliant, but you don't have to face the long costs that involves. Now, one of the things that leads into, and I think it is so important that you as managers begin to think about how your leadership framework is looking. We want to show great leaders, and we want to ensure that they are seen not only within their working environments, but also they're seen by CQC and their local communities. So we want to ensure that quality framework is available to you. Please take a look at the code of practice and ensure that you can support yourself by using that self-assessment tool that allows you to identify any areas you may need to develop further to be the leader you want to be. Now, those of you who've been around here for quite some time, we know very well that the care certificate has been an ongoing conversation. And finally, we're pleased to say that over the last year or so, we've really got to the point where that care certificate has been embedded into regular training that allows your staff to get that core knowledge they need to not only work for you, but also take their career forward. And we're looking more and more about the careers of the future now. So think carefully about whether you are appropriate, your staff team are appropriate to do the care certificate as part of the induction in the level 2. And then think about that funding that you can claim back, knowing that your staff are well trained and you've been recouped for the funding. Really makes that induction something that's a lot more powerful to you and shows the value that you have for your staff at an early stage of them joining that team, and also existing staff embedding that knowledge to them. Oh, I want to talk to you about digital skills, and I'm not going to dwell on this for very long. And I'm probably going to come to a bit of an end at the end of this because I do feel that the digitalization is the future. Everyone is asking us to ensure our digital skills are not just sitting in the office, but also with other members of your team. Ensuring that you have a really strong understanding of not only the software that you've probably spent a lot of money engaging in, but also how that software supports your team to be the best they can and how it ties into the other resources that you've got at the moment. Now, digitalization can be really terrifying for a lot of our teams, and I would ask you to think about maybe offering them the opportunity to do some bite-sized pieces. And as you can see by this particular PowerPoint, we've got some really nice little e-modules that give people the confidence they need to be able to really work with digitalization on a daily basis. But more importantly, as leaders of the organization, you may want to look to formalize that digital leadership skills that you have. And I myself love this level 5. I think it's a really good opportunity for people to shine and show that they have an interest and really help them look to the future of how digitalization is going to improve our lives across the board, frontline workers, back office workers, but most importantly, it can be a great opportunity for the people that we provide services to. I'm going to send this email out to you because I think we're coming towards the end of our time and I don't want to overburden you with information, but within the PowerPoint that we'll send is upcoming events and seminars. And I would ask you just to take a little look at those and maybe have an opportunity to see whether there is anything there that will help you and your team work well in the future. So I'm going to stop sharing my screen and hand back to you, Dudley. I hope that isn't too much of a whistle stop. I'm going to put my details into the chat as well. So if there's anything that you feel that you would like us to support you with moving forward for your workforce, their training, and also for you as individuals and how we can support you to ensure that you are confident and competent in the work that you do, just email me. I have a great opportunity to talk to any of you, and I really want to know what's going on, some of the challenges. One of the things I notice a number of times, people just come online and they need to vent. And I think venting is really important, but it also is a really creative space to come up with the solutions that you may have. So I'm here, always available and really keen to ensure we've got the best services south of London, and if you're from the north, Dudley, I'm sorry, but north of London too. Thanks for your time.
Thanks for that, Ali. And how eloquently put and spoken, Ali. I think it's really important. A lot of the information is shared. I know it's a whistle stop tour on it, but whilst we have you here, is there anyone who wants to ask any questions? Specifically, I know with some of the funding that's available there, maybe there may be one or two may want to ask questions. If not, you can always get in touch with Ali. And I think the reason why I do say that, I think, is that someone's got a question. I'm not sure if they have.
It's me, sorry.
Okay.
Yes, I have a question.
Oh, you've got a question. Hello.
Hi, it's Pfizer here again. The funding, is it all of it coming on to an end 30th of March? Or is
we are
there
waiting for an update, and I would love
Thank
to be able to say to you that we have been given a nice early update as to how the funding is going to look into the next financial year. But for those of you that appreciate Dudley's giggling at this point, there are reasons why we wait for these things. To be perfectly honest with you, this is an ongoing training package that has been there, and the government is aware that if they want the services, they've got to pay and support us to do this. So unofficially, I would say our funding is definitely going to be available to support you as you move through the next stages. Officially, we haven't had it confirmed, but I think all of us know that the government want us to be the best we can, so they will support us to be the best we can.
Thank you. And the training is available for managers, coordinators, care workers themselves?
If you look at the list,
certificate.
Most definitely. And if you look at the list that's available through the government, they give you all of the training that they're prepared to provide. I would always read through it because, again, it's a really creative point to be able to see what's available that you may not have thought that you could bond in your teams with. So think carefully about not just what you instantly think as your training needs, but also what is available as a training funded opportunity. You may find you've got members of staff who are particularly interested in an area you haven't chosen to really expose before to them. But yes, that training list is there, and anything on that training list is claimable.
I think what and all of the people will in care sector will agree with me. We all need a resident counsellor in our organization, or a resident de-stressor or something like that.
My personal thought is everybody should get a dog, but that's my own personal thought. That's where I de-stress. But I agree with you. I think having that opportunity to give your staff a opportunity to talk about things and a space to, first of all, make sure your staff know that that's something that you're really keen to do. They may just push your door to talk to you about various bits and pieces, or you may find that peer-to-peer support is the way to go. But certainly I will feed back right now to our feedback tools that we have for the department and say one of the things that's been highlighted is the fact that internal support and counselling.
Yeah, like, we have occupational health.
Yeah.
This is health and social care, occupational health.
I love it. And I'm going to feed that back. That's really great. Thank you for sharing that.
We have your email address, please.
I've put my email address into the chat. Okay,
thank you.
So please do. And I will be sending this out. I'll put it into the WhatsApp as well, so that you've got that there just to be able to keep a record. Okay.
Yes, and I think that's so fantastic, Ali. I think twofold. So I'm going to be a bit upset with most of you as providers, because it's really sad that Ali has suggested this and we're coming to the end of the year. This has been available all year, and providers always wait to the end of the year and start saying, oh, where is this funding? And it happens all the time. So one thing which is really sad is the government actually will turn around and say, well, you've only used so much, so you don't really need this amount of money. So that pot becomes smaller and smaller. If we're taking up the funding, the government knows it's the amount we need. So please, 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 whether you're going to be doing it this year or going in the future, take up the opportunities of training and funding. And if you really are unsure, the likes of Ali or ourselves can point you in the right direction. So that'll be my sort of bugbear regards to that one. But I think it's always available and people should actually utilize it. Secondly, I also share your sentiments, Ali, and what was talked about the well-being side of things. Funny enough, we at Lcas ran a wonderful platform called Keeping Well, and that was really fantastic. We allowed people to have access to more professional services if they needed someone to speak to an IAP service. We also dealt with things locally. We ran competitions, and we had a website was really interactive. And I think that's lost, especially in this day and age of just knowledge, where to go to, where to find maybe food banks, all these sorts of things that you probably wouldn't under normal circumstances. And I do agree. I think it's something that hopefully that the government or someone or other funds again, because it was really a wonderful sort of platform that was up and down the country after COVID. So sorry to see that it went, but hopefully it's something that can be done. So thanks, well said. I know we're running short of time, so thank you very much, Ali, for all that you've done. Just for me, I'm just going to jump in for one or two updates very quickly, because I know we're short of time. Lcas have been really trying to support various matters. I'm going to share my screen. So a few bits of information. So regards to the DSPT, what we're talking about. So hopefully you can see my screen. Everything's okay. Can you see my screen, everyone?
Yep.
Okay. Yep. So just very quickly, if you do, Harry put his information in the chat box. If you actually need to book a session or find information, this inquiry for the DSPT here, you can actually contact us on a dedicated email address, which was all things DSPT. We also share, and we're going to be updating our website at some point for that. Also, two things just to highlight so that you are aware. We've got an international sponsored recruitment latest webinar. I know a lot of people who are using sponsored workers may have had concerns and heard about lots of revocations. We're going to be having a session which is going to be covering mainly Southeast London, but North London, should we say. People are all welcome. It's around issues on recruitment, home office licenses, challenges, revocations, all of the above that you're hearing, 20-hour rule. If you have any questions also as well, you can send it to Peter or myself. So that's going to be taking place. I will try and share and put that out, if not put it out in the chat. So that's one of the things I will try and do. Also, as well, we will be doing one as well for Southeast London. That's going to be the 1st of April. Similar time, 10 a.m. to 11:30, and we'll be covering things across that. But there'll be more tailored to different areas, covering anything across that. I know there's various things going on. There's a lot of information. Peter gets called all the time about, can you place their workers that are displaced? And I'm not sure if Peter feels he's going to be displaced at this moment, but the most important thing is just getting the right information. As we know, the Home Office are really being very strict and zero tolerance on even if you get £1 out of place or things like that, and they're literally just sending out revocations. So actually having your audits in place, making sure you know what you're doing, being compliant, and really going through things before they actually knock on your door or actually get in touch with you. So those are the things that I think are important. I will share as much of that information as possible. I'll stop sharing my screen. Also as well, for anyone from Southeast London, what we've been doing as well is been running some sessions that have been available for any sponsored workers who are working presently in organizations. What we've done is we've been running a real 3-hour session, and for people to sign up in the workplace, it's free of charge. And if you click the link here, there's some various dates that are happening, and you hopefully should be able to click on and then pick for any of your workforce who are sponsored or international staff to actually join. It's an empowering session. It's giving them information, data, and helping them more confident to actually help, especially we know there's a lot going on. So these are a couple of the things that I'm sharing there. Peter, I'm not sure if there's any information you want to add to that at all.
Thanks, Dudley. I've put quite a lot of stuff in the chat, and I will do a news update. I've had some information come through this morning about CQC Reg 9A, which I haven't yet read, but I will add that to the update. We have been asked by the Care Association Alliance to let them know about fee updates. So if you can email me or email Dudley with any information about fee updates, what they relate to, whether it's care homes or learning dis or DCAs, it's all confidential, so no one's going to come back to you. And if any of you are working in the neighbourhood plan in Croydon, again, we've been asked for information on how that's going. We have contacted Croydon and heard absolutely nothing back, so that would be very useful. And as I say, there's a whole pile of stuff going on at the moment. So we'll put out a newsletter, we'll put out the recording and the presentations from today as soon as possible. And the apologies again for the initial problems with the IT system. Thanks very much.
Yeah, and from me, any information you've not got, we'll be sharing information in the WhatsApp groups and via email. And also we'll be having the links on the website as well, so you're able to access any information as well. And just a reminder, as I said earlier, me and Peter are meeting with CQC on the 27th. So if there's any queries or questions that you want to have and ask, please send it through to us so we're able to actually let people know. One of the things that we are really conscious of and what CQC tell us is that no one comes back to them with information. And if they don't come back to information, it means there's nothing wrong. And we feel that it's important in regards to that. So please, please, please make sure that you actually are sending out and letting us know with any information that you have in regards to that. That'll be very helpful across the board. Other than that, I will wish everyone a wonderful remainder of a sunny day if you're in London at the moment. We're very lucky, so spring is really upon us. And other than that, I will see you at the next meeting, or if not, we'll see you at the Care Show at Excel at the end of April as well, where we'll have a few sessions going on. Thank you, everyone.
Okay. And just to add that from me, and get the rest of your day back, and we look forward to seeing you in